I am Dr. Bhavna Gupta, working as an assistant professor at Khalsa College of Nursing, Amritsar. Today I am going to discuss a very deadly disorder, or you can say that it's a disease which is also create a social stigma in the society because of its deadly nature. It is preventable, it is treatable, but though it creates a social stigma in the society, and the disorder is called as hepatitis. Hepatitis in the regional language, I will say that it's a kala pelia. So it is a social stigma because of lack of knowledge in the people regarding hepatitis. So what is hepatitis? Today I am going to discuss with you people. Hope you people will understand what is hepatitis and the social stigma will not remain in the society. So what is hepatitis? Hepatitis is a inflammation of the liver. Inflammation of the liver occurs in the body when the tissues of the liver are injured or they are infected by the virus. Hepatitis can be acute, that is short term, and chronic, that is long term. So it may be acute and it may be chronic. It is depending on the types of hepatitis. So firstly we will discuss the types of hepatitis. So first type of hepatitis is viral hepatitis. Viral hepatitis is the most common type and it is the most contagious hepatitis. In this, the types are hepatitis A, B, C, D and E. The second one is alcoholic hepatitis. Alcoholic hepatitis occur in those persons who are taking alcohol from the long term. Third one is toxic hepatitis. Toxic hepatitis occurs due to medicines, the drugs, the person who is taking drugs and the person who has taken poison or any other chemical. So that will cause the toxic hepatitis. And the last one type is autoimmune hepatitis. Autoimmune hepatitis is that hepatitis in which our body cells eat the liver cells. That is called autoimmune hepatitis. Next, I will discuss the types and the first type is viral hepatitis. Viral hepatitis is the most common type as I already said that, and it is the most contagious type and it is most prevalent in the society. It contains hepatitis A, B, C, D and E. So firstly we will discuss the first type and that is hepatitis A. So what is hepatitis A? Hepatitis A is a disease which is caused by hepatitis A virus. So next is how it spread in your body. So how it spreads in your body, that is mode of transmission of hepatitis A. So the mode of transmission of hepatitis A is orophycal route. Oral fecal route means through oral and fecus it spread in the body of the person. It can spread sexually. I want to say here, it can spread sexually also if the sexual fluid is mixed with the fecal fluid of the person. Then it will definitely spread through the sexually transmission. Otherwise, its route is orophycal route. Next is the sign and symptoms of hepatitis A. How one person or how we diagnose or how we'll tell that the person is suffering from hepatitis A. There are three main clinical features in hepatitis A. The first one is clay colored stool. The stool color is clay colored. Mostly our stool color is yellow. But in hepatitis A, the stool color is clay colored. Second one is yellowishness of the eyes and the body. In most of the terms we can say that jaundice, that is pelia. And the third is itching. There is lot of itching in the body. There will be diarrhea, there will be nausea, vomiting to the patient, there will be lot of itching on the body, there will be small hives on the body due to itching. Next is if the person is suffering from the symptoms, then how we will diagnose that person is suffering from hepatitis A. In hepatitis A, we will get the blood test and in the blood test we will find the hepatitis A virus, that is hepatitis A antigen. And the second thing is immunoglobulin M. In hepatitis A infection, the immunoglobulin level raises in the body, and that immunoglobulin is immunoglobulin M. So next is, what will be the treatment of hepatitis A? We will diagnose that if the person is suffering from hepatitis A. Then how the treatment will work? So the first one is hydration. We will have to hydrate the patient because its mode of spread is fecal oral. It is spreading by fecal oral route. The symptoms are nausea, vomiting, diarrhea. So we have to give attention that we have to hydrate the patient. We have to maintain the fluid balance of the patient because in some time it is a self-limiting disease. अपने आप ही जो ठीक होने वाला है वो वाला, ठीक है. Otherwise we have to maintain the fluid. We have to maintain hydration of the patient. So we will give the fluids to the patient. We will give electrolytes to the patient. So the hydration of the patient will be maintained. So it's a preventable disease. It's a treatable disease. Its vaccine is provided in the society in our immunization schedule at 12 months of the baby. When the baby is of 12 months, then hepatitis A first dose is given to the person. Next is at the 18 months. 18 months we will give the second dose of hepatitis to the person. And in the adult age, if the person is getting hepatitis, then at the at any age he or she can get the hepatitis dose, and after 6 months the second dose will be taken by that person. So with the next type is hepatitis B. We have discussed viral hepatitis, and in the viral hepatitis the first one infection was hepatitis A and the second one is hepatitis B. Hepatitis B is an infection which is caused by the hepatitis B virus. It is obviously preventable and treatable. Preventable, that's why, because its vaccine is available in the society. In the WHO schedule, immunization schedule, we are providing vaccine to the person so that in the lifetime he will not get the hepatitis B infection. But even though if he or she will get the hepatitis infection, they will get the vaccine according to their disorder. So what is the mode of transmission of hepatitis B? There is two mode of transmission of hepatitis B. The first one is blood and second one is sexual contact. How from the blood? From the blood, if you are using the infected razors, needles of the person who is infected from hepatitis B. Secondly, from mother to child. If the mother is suffering from hepatitis B, then definitely if she is pregnant, the baby will definitely 100% will get hepatitis B during vaginal delivery or during blood to blood contact. So to avoid that, we will always go for cesarean deliveries. In that, we have very less blood to blood contact. And second is sexual contact. If you have multiple partners and if your partner is suffering from hepatitis B, you will definitely get the hepatitis B infection. Next is the symptoms. How we will know that the person is suffering from hepatitis B. If the person is having hepatitis B, the symptoms are jaundice, hives, that is small hives on the body of the person, then nausea, vomiting, diarrhea. These are the main symptoms of hepatitis B. There will be fever, there are the B symptoms always there, night sweats, fever, they will be there, but the main symptoms are jaundice, nausea, vomiting, loss of appetite. These are the symptoms which is in the hepatitis B. Now, how you will diagnose hepatitis B? If the person is suffering from hepatitis B, we will get a blood test. In the blood test, we will get to know that the person is suffering from hepatitis if there is a detection of antigen hepatitis B. And secondly, in hepatitis B, we will definitely go for liver ultrasound. In the ultrasound, there is inflammation. If the inflammation is more, that is there is grading, grade 1, 2, 3, 4, and if there is inflammation, then we can say that the disease is chronic or the disease is acute, and the viral workload. The viral load, from that we will able to know how person is suffering from hepatitis B. Either is it acute or it is chronic. Next, we will go for the treatment. In the treatment of hepatitis B, we will give antiviral drugs to the patient. Antiviral drugs include lamivudine, introvitire. These are the drugs we will give to the patient. Next is interferons. Interferons are the flares which is produced by the body to fight with the antigen. But interferons can't be prescribed to the pregnant women. And if the woman wants to be pregnant, then she or he will not get interferons at all. Next is vaccine, which is maximum used, which is in our WHO immunization schedule at birth, that is 0 dose. 0 dose we called at birth, we called it 0 dose. At 6 week, the first dose of hepatitis B. At 12 weeks, there is second, and at the 14 weeks, the third dose will be given to the patient. And if the person is pregnant, the female is pregnant and she diagnosed with hepatitis B, then we will not give any treatment to the patient until the third trimester. In the third trimester, we will go for the test of hepatitis B antigen, we will go for liver ultrasound, and then we will go for the viral load, and according to that, the prescription is described to the patient, the drugs are given to the patient. Otherwise, we can't give any treatment to the pregnant lady. When the baby is born, during delivery, we will go for the cesarean delivery, and secondly, we have a pediatrician near the lady, because that pediatrician will give the immunoglobulin to the baby according to the weight of the baby. We will provide the immunoglobulin hepatitis B vaccine to the person, to the baby, so that he or she will not get hepatitis. Next is hepatitis C. Hepatitis C is an infection which is caused by hepatitis C virus. It is not preventable virus because its vaccine is not available in the society. It is treatable, but it is not preventable because its vaccine is not there. So what is the mode of spread? The mode of spread is same like hepatitis B. That is, first one is blood contact and second one is sexual contact with the multiple partners, or if your partner is infected with the hepatitis C virus. Next are the symptoms. Symptoms will be the same as that of hepatitis B. There is itching, there is nausea, vomiting, diarrhea, hives, lots of appetite. These are the symptoms, fever, itching on the body. These are the symptoms which comes after hepatitis C infection. Next is the diagnosis of hepatitis C. The diagnosis will be the blood test, definitely. The blood test will be there and we will go for the blood test and we will find the hepatitis C antigen virus there. And secondly, we will go for the liver biopsy if we want to find out the severity of the disease, how much liver is damaged, we will go for the liver biopsy. Next is the treatment. The treatment are the same, antiviral drugs, interferons, and the last option we will have the liver transplantation. If the liver is so much damaged, then we can go for liver transplantation for that person. The next types are hepatitis D and E. The hepatitis D virus only getting to those person who is having hepatitis B infection. Otherwise, it will not occur singly. If the person is suffering from hepatitis B, then definitely he will get the hepatitis D vaccine or D virus later on. And hepatitis E if the person is suffering from hepatitis A. So, if the person is suffering from hepatitis A virus, he or she may get the infection of hepatitis E because the route is same, fecal oral, and in hepatitis D the same route is there, that is related to hepatitis B, that is blood and sexual contact. The symptoms, otherwise the symptoms and the treatment is same of that of hepatitis B. So I think so it's all clear about the hepatitis infection, and I think so the persons are easily, it's a understandable, it's a preventable disease, it's a treatable disease. If we are able to know the symptoms earlier, we can treat this disorder very effectively. Thank you.